Hi, everyone, and thank you for attending the Resource Rundown. This is your introductory guide to accessing services, and for this Resource Rundown, we will be focusing on services for those who are 18 and older. Please keep in mind that this presentation is a broad overview, and if after this session, if you have additional questions, then I encourage you to please reach out to us at kidsthrive@wv.gov. Okay, let's get started. Have you ever wondered about available services for those who are aged 18 years and older with a severe mental illness? Maybe they've had multiple hospitalizations and wondering if services in the community are available. Maybe you have no idea, but you're interested in finding out more. If any of that sounds familiar, then it's a good thing you're here. Sit back, relax, take notes, or leave this on in the background while you multitask as you tune into the Resource Rundown, where we talk community-based services for those who are 18 years and older. We're going to keep things as uncomplicated and as straightforward as possible. This Resource Rundown is all about Assertive Community Treatment, otherwise known as ACT. If you've never heard of ACT, good thing you're here. And if you have, then fantastic. But Assertive Community Treatment is a community-based treatment for individuals with serious, persistent mental illness. What is a serious, persistent mental illness? I will explain that in just a minute. But first, it's important that we explain the difference between ACT and what we call CSED. First, let's define CSED. CSED stands for Children with Serious Emotional Disorder, which is the name of the services a youth receives in their home or their community for their mental health, behavioral, or emotional needs. So in other words, CSED is simply part of wraparound. ACT versus CSED. If someone is aged 18 to 20 and they're receiving CSED, can they or when should they switch to ACT services? Since there is no time limit on ACT, whereas CSED, there is the time limit of a 1-year program, someone who is currently on CSED can move to ACT once they turn 18 or at the end of their CSED program. If you want more information on CSED, you can click on the video that's just below this one on the Kids Thrive Resource Rundown webpage. Now back to the serious persistent mental illness. What is that? It's more than just a feeling of sad or down. Maybe they're seeing or hearing things that are not there. And maybe they have extreme mood swings, or they're withdrawn and increasingly paranoid. A severe mental illness, such as schizophrenia, bipolar disorder, schizoaffective disorder, etc., it affects a person's thoughts, their emotions, and their behaviors. It's complex and it requires professional support. What is the goal of assertive community treatment? The goal is to keep people out of the hospital and to help them have a life that isn't controlled by having a mental illness. People who experience severe symptoms and have severe difficulties with basic everyday things, such as staying safe or caring for their physical needs, or keeping safe and adequate housing and working, they may benefit from assertive community treatment programs. Assertive community treatment, it provides a primary and direct service ACT provides comprehensive and intensive outpatient mental health treatment, as well as support services to anyone who needs help beyond traditional community mental health services. Most of the services provided by ACT are provided in the community. That means in your home, where you work, or in another setting in the community. Services are available 24/7. There's no time limit to receiving ACT services. The ACT team makes a long-term commitment to people for as long as they need. These services can include assertive outreach and continuous engagement with individuals, comprehensive and appropriate assessment, individual-specific advocacy, assistance with securing basic needs, coordination of living arrangements, and any necessary maintenance visits, counseling, problem-solving, and personal support, psychiatric services and medication management, ongoing involvement with the member during their stay in a hospital setting to transition back to the community placement, and sustained effort to engage in treatment, medication education, and skill activities. Some benefits to ACT include less psychiatric hospitalizations, better engagement and treatment through a mutually agreed upon service plan, greater knowledge of their need for medication compliance, the nature of the disease, and early warning signs of psychiatric difficulty, increased independent living skills within their own community environment, enhanced clinical relationships with their support systems, and improved integration into the larger community. So how do you get started with ACT? First things first, you'll want to call the closest comprehensive mental health center for information on their ACT program or the closest ACT program. On the screen is a map of the comprehensive mental health centers. There is no referral form needed. An intake will take place to gather current and your past history, treatment, and medication information to ensure that they meet the admission criteria for ACT. The ACT team will meet with the individual or the guardian or family to explain what to expect and what services they have identified that the member needs in order to be stable in the community. Who do you contact? Contact your local community mental health center. A map from the previous slide can be found online at our Kids Thrive Resource Rundown webpage. Thank you, everyone. And I understand that that was a lot of information. So please don't hesitate to contact us at kidsthrive@wv.gov with any questions you might have, or if you would like additional information. Thank you. Have a great day.